The necessary equipment for this skill is a BVM with oxygen source, a simple airway adjunct, laryngoscope and blade, ET tube and stylet, water-soluble lubricant, end-tidal capnography or colorimetric device, and a suction device with appropriate catheter. The recommended PPE for this skill are gloves and eye protection. Once I've gathered all my necessary equipment, I'm going to pad behind the patient's shoulders to maintain a sniffing neutral position. I'm going to measure and insert a simple adjunct using a tongue blade. I'm then going to ventilate the patient at a rate of 12 to 20 breaths per minute, allowing for adequate chest rise. I'm now going to have my partner continue to ventilate. Once the patient is pre-oxygenated, I'm going to have my partner discontinue ventilations and remove the airway adjunct. I'll be assessing for hypoxia throughout the intubation attempt. Insert the laryngoscope, just place the tongue, visualize the cords, insert the tube to the proper depth, remove the stylet, inflate the cuff if using a cuffed tube, and ventilate the patient. Have my partner take hold of the tube and continue ventilation while I confirm placement through auscultation of the lungs bilaterally and over the epigastrium. Going to attach our end-tidal capnographer. Secure the tube. Once the tube has been secured, I'm going to continue to ventilate the patient at an adequate depth and rate while observing for capnography and